Good afternoon, and thank you for joining us today. As you are all aware, the threat of the coronavirus, COVID-19, has caused our state, nation, and world to take unprecedented actions as we work together to combat the spread of this virus. When Governor Abbott issued his executive order last week, he recognized that COVID-19 poses an immediate threat of disaster for all Texas counties. The governor took steps to close bars, restaurants, and gyms to limit gathering of more than 10 people, to restrict access to nursing homes, and temporarily close schools. This week, the governor stated that he was leaving discretion up to the cities and counties for additional steps, since what is right at this particular point of time may differ across 254 counties. Just before I've opened this press conference, the governor will be having a press conference at 2:30 and make his statements. And whatever the state decides to do will supersede what we've said here today to talk about. I'll remind you that he will be speaking at 2:30, and he might be making some statements that will be different than what we're saying here today, and we will be following what the governor instructs. Locally, I would like to thank the leaders of our area cities, hospitals, emergency management for working together to address the needs here in Gregg County region. So far, we have been fortunate to only have one confirmed case within Gregg County. As of yesterday afternoon, numbers provided indicated we've had 48 tests submitted for the virus. Of those, 23 tests have been negative. There are still 23 tests pending. I want to remind you at this point is that every county around us has got a confirmed case of this virus. Some have more than one. And I'll remind you, part of this action we're taking today is a result of sitting in the middle of a hot spot, and that's where Gregg County is. But we also know that the number may be artificially low due to limited availability of testing and the slow process to get the results. As such, we believe we need to address the situation as though there are multiple confirmed cases already within our county. It is imperative that each take personal responsibility to do what we can do to reduce the spread of virus. I urge everyone to use extreme caution and take these shelter-at-home guidelines very seriously. They are being voluntarily conveyed today, and I'll let Dr. Brown talk about more of that and Mayor Mack. We are fighting an enemy we cannot see. We are in the process of trying to secure more testing and efforts to acquire additional personal protection equipment for our first responders. There's a delicate balance of keeping our citizens safe and maintaining our strong economy. As part of the shelter-in-place guidelines, individuals should remain at home except for essential activities and business, grocery store, healthcare, banking, and your job. Additionally, to the extent of sharing space, continue to use social distancing, 6 feet. Continue to practice good hygiene by washing your hands and not touching your face. We must continue to do everything possible to protect our citizens, first responders, and the professionals, because it is these people that are on the front line every day to protect us. This directive by Dr. Brown is voluntary, but if we discover additional cases, either by travel and/or community spread, Dr. Brown has the latitude to give guidance regarding these additional measures. We are all in this together as a community. All our cities are part of this county. Some say this is not necessary, while others say it's about time. I assure you, much study has been put into this decision, and we continue to meet daily regarding this matter. As I've said in the past, these are uncharted waters. We won't want to look back and say we didn't do everything we could do. Now we are going to hear briefly from Dr. Brown, Gregg County Health Authority, who will give us his overview. Dr. Brown?
Thank you, Judge. Just to reiterate, we still only have one case of COVID-19. As the judge already said, we are surrounded by counties that have positive cases. We have one county that doesn't have any cases, but virtually we are surrounded. Harris and Dallas have already gone to phase 3. They are so much further ahead of us as far as the number of cases and infections but we're still trying to be responsive to make sure we are responsive to this infection. Eastman, as mentioned in the paper, has already gone to some more strict guidelines with their travel. We're all connected to these surrounding counties. People live in the surrounding counties and work here. People live here and work in surrounding counties. So we're taking that very serious about how interconnected we are. This is not a sprint. This is a marathon. We have got to pace ourselves and pace ourselves well. I want to stress what is needed is to be more vigilant in our limiting contact. I believe that people are doing fairly well at this time, but we need to continue to work on that and be more vigilant. I want to recommend more sheltering at the home, and again, making sure that people are not driving around contacting stuff when they don't really need to be. I watched people over the weekend and yesterday when I was going around the hospital and up to the courthouse and to the county clinic, and people are really slowing down, and that's very encouraging because that's the way we're going to slow this down. I do think we need to continue to allow businesses to be able to work because that's what feeds our economy. The health professionals, the cities, the county will continue to be on the forefront for this.
Thank you, Dr. Brown. And at this time, I'll ask Mayor Mack, who has been equally concerned, as all mayors have been in this guidance, and the steps that need to be taken to give his remarks. Mayor?
Thank you very much. I wanted to come today to give you an update on the COVID-19 and how it's impacting the city of Longview as well as Gregg County. As the judge stated, to date, Gregg County has 1 confirmed positive, 23 pending results, and 23 negative results that have been shared with us per Gregg County Health Department. I'm only reporting to you tests done on patients that reside in Gregg County. Other tests have been performed on patients that do not reside in Gregg County, but those statistics are not part of our report. We still have test kits, although very limited, but they are available, but very limited. And we are doing everything we can to get more test kits available to the Gregg County areas, but those are in short supply, and we're doing all that we can to do that. As you look around us, we see 120 miles to our west in Dallas County and 45 miles to our east in Louisiana. Communities are scrambling to have enough health care resources to flatten this curve and have warned us to move faster than they did to try to have a fighting chance to save our residents and not completely crush our healthcare system. Louisiana has one of the fastest growing numbers of coronavirus cases in the United States right now, and they're our next door neighbor. Based on data collected and watching communities similar to ours, we are issuing this voluntary shelter-in-place ordinance for all of Gregg County effective immediately. We're asking you to voluntarily comply with these requests. It is one of the only things that we can do to try to give our healthcare professionals a chance to combat this virus. In the event that we have one more confirmed case in Gregg County, as Judge Stout stated, whether it's travel-related or community spread, the shelter-in-place will become mandatory at Dr. Brown's discretion as well as Judge Stout's. Right now in our Longview hospitals, we have approximately 650 hospital beds. However, some of those beds are already occupied with other sick people. We're working hard to ready the exhibit hall parking lot and the rodeo arena and Mon Cobb Convention Center for drive-through testing facilities and to help overflow from hospitals as needed. Between our 2 hospitals, we have approximately 52 ventilators with plus 40 anesthesia machines that could be used in dire emergency. Of course, some of those are being currently used by patients as well. So while this might seem presumptive to some of you, this seems like the most prudent and responsible thing to do, especially if you look at the CDC statistics on this virus. If you look at what the CDC says, 40 to 70% of the population will be affected by this virus, 40 to 70% of the population. You can do the math on your own populace. Of those affected, 80% will do very well with this, but 20% of them will require hospitalization. Of those hospitalized, 5 to 10% will require ventilators, which we're in short supply of. How accurate are those numbers? Only time will tell. I'm one of the mindsets that I plan for the worst and I hope for the best. We must find a way to ease the burden on the healthcare providers and first responders that will undoubtedly be battling this issue. Any steps we take that help achieve that are positive steps. I understand that this will be and require sacrifices from each of us, more so from some, less than others. But remember what the goal of this is, to save lives and to reduce the number of people that contract this virus in our community. With Longview being the county seat for Gregg County, our two hospitals serve not only the 80,000 Longview residents, but also the surrounding areas, with our daytime population swelling to nearly 250,000 daily. Because of that, we absolutely must do what we can to not overwhelm these vital healthcare systems. As you've already heard repeatedly, the most susceptible in our society are the older people, the greatest generation. Right now, these older people are locked away, deeply isolated and lonely and hoping and praying they don't get the coronavirus because their odds of survival would not be very good. The least we can do for this greatest generation is to stay home and give them their best chance at survival. And younger people, please do not be misinformed and think that you're immune to this. There are more and more cases of younger people getting the virus and getting critically ill as well. The best thing to do for all of us is to stay home if we can. Please note there are many, many businesses that are essential to keeping our city and our county going, more than most of you would think. The goal of this plan is not to cripple and shut down our economy, but to slow the spread of the disease. We want and need essential businesses to be productive. But in doing so, we must adhere to the guidelines that will help slow the spread. 10 people in a room, 6 feet apart, wash your hands, don't touch your face, wear personal protective equipment if needed or required. All these things that we know will help slow the spread of this disease. So even if you have to go to work and perform an essential job, and if you're an employer of these employees, do so with consideration for their safety and health and welfare of the community. If you have questions about whether your business is essential or not, you can visit www.longviewtexas.gov/COVID-19. On the good news, as the President has said, he welcomes public-private partnerships in attaining supplies for our healthcare and first responders. We were contacted just yesterday by a local businessman who had the ability to get us 5,000 N95 masks in short order. Of course, we are in the process of purchasing those masks at a good price to get them to our healthcare workers right here in Gregg County as soon as possible to keep them safe. If you or your business have the ability to donate or sell us gowns, gloves, N95 masks, or the like, please reach out to the Gregg County Health Department or the City of Longview, and we will get those supplies to our workers. Longview will get through this one day at a time. We're going to be stronger than ever because we did this together. With each of us making personal sacrifices for the greater good, we can help. What can help but make us stronger? I want to encourage all of you to take time each day to pray and thank God and His help for guidance through this. Ask Him to be with those in need and to be with those healthcare workers who are fighting on the front lines, and pray for your community leaders making these decisions. We need His help more than ever during a time such as this, and I believe if we ask for it, we will receive it. Thank you very much.
Thank you, Mary. At this time, we'll take a few questions.
Judge, just to clarify, you're recommending that people shelter in place for the time being for the citizens' best interest, right?
Mm-hmm. Yes, but it does not keep them from doing their daily routine. If they need to go to the store, they need to go to their job, they need to do other things. This basic plan is about to raise the awareness of everyone in the community that this is a real threat to this community. It's a real threat to this state and this country. And we've all got to take personal responsibility to take care of our neighbors and ourselves at the same time. I've been amazed at some of the people that continue to go around like this isn't in our community and act like it's not going to touch us. There's too many people that are giving very good, educated input for our direction that we're having this press conference today.
And also, even though Gregg County has one outbreak, people are still going about their daily routine, but it also does it show that they're concerned how even though people are conjugating in the supermarkets and stuff, how they're taking it seriously, how they're actually going through the proper channels of like keeping themselves safe.
Yes, and that's the whole thing. We can't stop people because the economy can't stand that, but we can lessen the exposure and spread of the virus if we start doing certain things within this community. And the beginning is that voluntary shelter at home. That does not stop you from doing what you need to do. And I think if you'll go to the website that the Mayor Matt gave you, it will outline all those things. And I think it will certainly eliminate a lot of fears of what people are saying on Facebook, which is most of it's not true, and a number of other calls that we've had in my office that just are just not true.
You mentioned Governor Abbott is having a press conference later today.
At 2:30.
And whatever he decides will supersede what you announced in this.
That's correct.
He stated before that he's not going to issue a shelter in place for the state of Texas. If he still stands his ground in that press conference, will the voluntary shelter in place still stand for Gregg County?
Yes.
Okay. And those 23 pending talked about. Do you know when you'll have those test results?
You know, the turnaround, you know, we are at the limit of testing. The turnaround is supposed to be within 24 to 48 hours. Some of the labs, we're using multiple labs. Some of them are really getting us results in about 1 day, and some of them are in 4 days. So some of those, as I recall, there's a few that are still 5 days old. We just haven't heard, but we're keeping tabs on that.
With more people coming forth and being tested, you see people being proactive, saying, hey, I think something's wrong with me. Let me come in, get with y'all just to be tested on the safe side.
Well, that's the problem of the limits of testing. You know, we cannot do that extra testing. Our testing has to be done by the CDC guidelines, and the hospitals have been very good about that. The ER has been very good about making sure that's the only ones they test. When we get community, or if we get community, the testing will be a little bit different guidelines, and we can test more people, but we're not at that ability to do that yet. And again, the availability of these tests, which are really being ramped up, there are some tests that are right on the guideline or on the horizon that we might get tests within, we're talking about less than a day, and there are some what we call dipstick tests that you can get results in a matter of 15, 20 minutes. So we're waiting for that.
Any recommendation for people who say, okay, I may be having a little sore throat and everything, because, you know, this time of year is the hay fever sinus season. Any recommendation for people, instead of jumping the gun, wanting to go out and get tested, any recommendation for them to just say, to see if it's something else before you come get tested?
Well, the main thing is to monitor your temperature. And if you have temperature, then if you start having shortness of breath, then you need to go to maybe the emergency room or contact your physician. But the main thing, if you having these mild symptoms, which we know people are going to still have colds and the allergy is really bad. Indeed, I'm a recipient of the pine pollen of East Texas. You really need to be thinking that, hey, that's right, I have that at this time, and that's what it is. You know, you shouldn't be having fever if you're having the allergies. The viruses, the colds and stuff like that, you may or may not have fever. It's the severity of the symptoms that need you to go to the hospital. But again, you can't test everybody, and you have to, that is how these facilities are doing. They're doing screenings to see who really needs to be seen, who's not. We're right now doing very well with our emergency rooms. They are able to react to the influx of patients that they have, which is very good.
I just want to make sure I have my math correct. You said there were 48 tests in total. 23 of them tested negative, 23 of them are pending, and one person tested positive that still needs.
I know. There is, when you're looking at the addresses, I can explain for one of them for sure. When you're looking at the addresses, one has a Longview address, but it's actually in Harrison County, and I do know that that was counted incorrectly. So I wouldn't make a big deal about one case or anything, but I know one of them's like that. It says Longview, but it's actually Harrison County.
With this shelter in place, how is that going to affect transportation, public transportation?
Our public transportation system will continue to run because we need, that's an essential business. But we will ask the same policies that we have been in place, spacing, no more than 10 people in an area, spacing 6 feet apart, you know, wash your hands, don't touch your face, all those things. But public transportation is an essential business. And I know the biggest concern I'm receiving from all the constituents of this area is the business thing. What is an essential business? If you go to that website and see, you will not believe how many businesses are essential. The majority of businesses are continue to remain up and running, and we want that. We need the business to remain up and running. But we need you to do safe practices when you're going to run your business for your employees, for their families and their health as well, for the betterment of the community. But the majority of businesses will continue to run, even if this goes to a mandatory shelter in place. The majority of businesses will continue to run because we must have our economy continue to thrive. So this is not to stifle the economy, it's to protect the citizens and prevent the spread of this disease.
Are you talking about the government officials or just citizens as a whole? I think everybody is. I mean, it's raising awareness. None of us have ever dealt with this before. This is, again, uncharted waters for anybody that's living in this great part of the state of Texas. Never has dealt with anything quite like this. And I think the awareness, this is what this is part of today, is bringing the awareness to the community. This battle's not over. This is a war, and we're going to win it, but it's going to take all of us together, working together, communicating together, making some hard decisions, of which this today was a hard decision, the way we've rolled it out. We firmly believe that when there's another case, and regardless if it's community transferred or travel, that there'll be additional steps. And this is said when the governor's going to be speaking at 2:30, so what we're saying today may change very quickly when the governor speaks.
Have you closed the city parks yet, Mayor?
No, ma'am, we have not. City parks are still open. You can still do recreational things like that. But we stress the gathering in large numbers. We don't want to gather in large numbers. We want to go out and enjoy the outdoors. It's a great place to be. There's space yourself out. That's the best place to be, is outside when this virus. It's the heat. It doesn't like the heat. It doesn't transmit well like that. But if you'll just not gather more than 10 people at a time and space yourself out, parks are going to stay open. That's a city service that will continue to be. And all city services are continuing to function. Even at City Hall, you can do 90% of your business online or on the phone through City Hall. You do not have to come to City Hall to do your business, but we will continue to provide the services, the essential services for our community on a day-to-day basis.
And Mayor, with these parks being open, is the city doing anything to sanitize them because they're public areas?
Yes, we are. We have sanitation crews out there constantly wiping things down, disinfecting, making sure everything is as sanitary as possible. But use good judgment. Don't drink out of the water fountain right now. I mean, because we don't know how quickly we can get it sanitized from one person to the next. Just take a water bottle with you. Use good judgment. But we're doing everything we can to keep the park sanitized and open and safe for our residents. But it's up to us to use common sense as well to get through this.
Are there any plans to increase trash pickup because so many people are going to be staying at home?
Not at this time. Unless we see a capacity need, then we would adjust from there. But right now, we're able to handle the needs of the city at this point in time with our normal schedule.
I have a question for Dr. Brown again. For people who might be experiencing symptoms or fear that they are you guys suggesting people go see their primary care doctor, go to an ER, or do they need to call ahead before coming to a hospital?
The first statement is to call ahead to either the ER and ask them their opinion, or if you have a primary care physician, to call ahead. That way they can be more reacted to that. Most of us are having to literally set up 2 waiting rooms, for the well people and then for the sick people. We're certainly, in my practice, trying to back off, our annual physicals and stuff like that to see how they do, because especially a lot of them are in that 65 and up, so we're trying to protect them. One thing, in reiterating what Dr. Mack said, I mean, going outside is actually a very good thing. Most of these viruses, as you know, influenza, they pretty well die down in the summer. That's because the heat, and that's also because of that wonderful ultraviolet source we have in the sky. And that's going to help sanitize the parks and sanitize stuff outside. But again, he's right. You want to make sure you protect yourself and you're not just touching things. But that's what we're hoping in the medical profession, that once the sun really gets going and stuff like that, we're going to start seeing a whole lot less viruses. We even see less bacteria.
I know that, let me get the doctor, I'm sorry. I know that just driving around the city, there have been tents set up, medical tents set up in front of hospitals. Is there any plan to increase that across the board throughout the county?
That's in the plans of what to do. We're having to be reactive by the level that is needed. The tents that are in front of the hospitals and in front of some of the very large clinics, I've talked to the physicians this morning, and they say that's going very well, and they're not overrun, but that does help keep the flow going well. And if we have to do more, we've already been dealing with this in the communications with the city, the county, the hospital. So The answer is yes, we can do it if we have to, but at this point in time, we don't have to.
For those who may have like elderly relatives or parents, grandparents, and know it's recommended to check in on them, is there a safe way for a person when they go to check in on the elderly to see if they're okay, besides just call them, just go, be able to put a physical eye on them and talk to them? Is there a safe way for you to just check in on them?
That's where it gets rather difficult because, I mean, certainly we're thinking about doing stuff like this for our home health nurses is to really interview the people either outside in their porch, which gives distancing, it gets them out of the house, and there's less contact on the porch instead of going into the house. And I think that may be the thing to try to do with the elderly population. If you can go visit them, if you really want to see them, you see them outside. If they can't get out, so they're very handicapped and really can't, you have to decide how close you need to get to them and how much you want to go into the house. The best thing to do is be, and some of these businesses to keep doing things is get the people to stay in the car and talk to them through the window. You know, ideally even through the window is better than with the window down, but you know, it's difficult. And I think just be common sense. If these people need to be seen, they are really highly isolated right now. But you really want to make sure that you can see them, but keep your distance. And outside, again, talking about that ultraviolet source, once things start getting nicer and hotter and everything, that's going to help us a lot. And I think when you think about the worldwide stuff, this has all been in the northern hemisphere that's been so bad. It's going to the southern hemisphere, but it's really bad up here because it's cold and chilly.
How long do you guys plan on having this voluntary shelter in place?
Until we see a change. I mean, you know, that's why we're trying to make steps, because I feel that if we go too far, that it's hard sometimes to go back, but we can. But certainly we're doing 1 week and 2 week windows on this stuff.
Overall, what would you say your number one priority is when it comes to attacking COVID-19?
Encouraging the public to get involved, to follow the guidelines and the recommendations that have been made by the Dr. Brown, Mayor Mack, and what you've heard over and over again, to be aware. One last statement, then I think we'll wrap this up if you don't mind. The courthouse will be open for limited business. There are some judicial activities still taking place. Obviously, the sheriff's department's 24/7, 365. The DA office is here. Both county and district clerks are open on a split shift. All of our departments are operating split shifts now. One comes in, the other comes back the next day. We're trying to eliminate the amount of people that we're all kind of working around. And so I would ask the community, if you need to do business at Gregg County Courthouse, possibly go to the webpage. You might be able to do your business on the website. And if it's just not absolutely required that you be up here, it'd be best that you just stay away. And I'm going to wrap that up right now if y'all got it. All right, good. Thank y'all very much. Thank you.